Hello, everybody, and welcome to the next edition of the Roundtable here at Pure Plastic Surgery, the surgeons behind the surgeons. All right, and our next question here is for Dr. Wegerif, and we are talking breasts. So, breast lift with or without implants, with or without GalaFLEX. How do we make these decisions?
All right, so this goes back to the patient, like always. First of all, what they're presenting with, and then what their goals are. So breast lift with or without implants really depends on what your goals are. If you are very deflated after breastfeeding and you want nice, full, lifted breasts, you're gonna need a combination of a breast augmentation with lift. Again, how do we determine if you need a lift? It's typically based on the position of the nipple in relationship to the fold of your breast. If it's at or below the fold of your breast, you more than likely need a lift. And with augmentation, if you're trying to restore volume. Then
What about the mesh? Like when do you think you should add a mesh?
So mesh, first of all, if you've had a previous lift with an augmentation and you've had issues with bottoming out, I think that's a clear indication that we need to try something different, because the definition of insanity to just keep chasing our tails, that's been a problem for you. And that's really where the GalaFLEX mesh or the internal bra is a huge help for patients. So for patients that are coming back for revision because their implants have just fallen quicker than we would expect them to otherwise, and then the other patient population is ones that may be massive weight loss patients or patients with just poor skin quality to begin with. We might use that as a primary adjunct. Or the patient that says, I just want my results to last as long as possible. This is throwing the kitchen sink at it, and this is everything we can do to help ensure that everything's gonna stay in the position we want it to for as long as possible.
Yeah, I mean, definitely the internal bra or internal mesh helps reinforce that lower pull. But at least for me, like I tend to not use it like in primary cases. I usually use it for a secondary case, reconstructive case, someone that's coming back. But Dr. Vidal, what are your thoughts on that? Would you ever use it for a primary case? And also, because sometimes your technique is a little different than ours, where do you think it's the best place to put the mesh? Because some people put it inside the pocket, and some people put it kind of, I guess, outside the pocket, in between the flaps of the lift.
Yeah, I tend to use it a little bit more, I think, in this table than the other two surgeons, because tend to have more massive weight loss patients, and I think that it is an excellent reinforcement. Majority of massive weight loss patients lose their elastin collagen, and they have very thin skin that's not going to support an implant. And most of them, because they have lost all of that, lose the volume of the breast. So most of them need implants to restore that volume. And with the poor skin quality, it's not going to hold the implant very well. So I do recommend it for my massive weight loss patients, and of course for redos, right? Patients that have had a mastopexy with implants and they have bottoming out or recurrence of the ptosis. But the other part is, yes, I think it's better to put it outside of the breast pocket, of the breast implant pocket, because I do believe that it's not only holding the implant, but the implant and the tissue to preserve that shape more long lasting. So I like to leave an extra layer of flap tissue in the bottom of the breast, and that's what Dr. Earle was mentioning about my technique, to cover the mesh so you don't feel the mesh, and it has extra coverage just in case we have any wound healing problems or anything. And then you have breast tissue and then the implant, so we have a lot of protection to that implant so we don't have any implant exposure, lost the implant or anything like that.
Quick follow-up to that. So then how long does this mesh take to get incorporated? Some people might be thinking, well, what happens if the wound opens up kind of early and the mesh just can't get in there?
Yeah, very good question. This mesh incorporates very quickly. So it incorporates within a week. And some say that within a few months, you go back and you don't see mesh anymore. So it's an absorbable mesh, but the benefit of it is it absorbs, but the tissue that's left behind is this thicker tissue that has more support. So it creates that scaffold of support without leaving permanent tissue or permanent suturing inside. So I think it has the both of both worlds. Of course, like everything, it's not for everybody. And I think it's an overkill to put it in every single case. But I think it is indicated for some patients, like I mentioned.
Again, great option, great tool for us to have in our toolbox for you when you come back if you have an issue, or like you have some of those predisposing factors like massive weight loss or poor skin quality. So great thing to have in the toolbox.